Hello, everyone. My name is Stephen Wong, and I will be your moderator today for this wonderful webinar. I am a recent PhD graduate from the University of California, Berkeley, and currently serve as a research and development engineer for the UC ITS Institute of Transportation Studies, the California Resilient and Innovative Mobility Initiative, also known as CA-RIMI, and the UC Berkeley Transportation Sustainability Research Center. On behalf of the UCITS and CA-RIMI, we welcome you to this exciting Part 2 webinar on challenges and opportunities facing public transit. Today, we'll be focusing on key considerations for public transit moving forward. We'll be hearing from 4 UCITS researchers, Professor Evelyn Blumenberg, Dr. Susie Pike, Juan Matute, and Professor Michael Manville on their recent work on public transit and COVID-19. Today, they'll be sharing key considerations for the recovery of public transit and for achieving the state's broader vision for more sustainable, equitable, and cost-effective transportation. Briefly about UCITS, the University of California Institute of Transportation Studies is an expansive network of faculty, research, and administrative staff and students dedicated to advancing the state-of-the-art in transportation engineering, planning, and policy to benefit the residents of California, the nation, and the world. Established by the California legislature in 1947, the UCITS has branches at UC Berkeley, UC Davis, UC Irvine, and UCLA. The UCITS statewide transportation research program is supported by the state of California through funding from the Road Repair and Accountability Act of 2017, also known as Senate Bill 1, and the Public Transportation Account. One of the unique and most recent initiatives funded by SB 1 is CA-RIMI, an initiative of UCITS. The California Resilient and Innovative Mobility Initiative serves as a living laboratory, bringing together university experts, policymakers, public agencies, industry stakeholders, and community leaders to inform the transportation system's immediate COVID-19 response and recovery needs, while establishing long-term sustainable and resilient transportation in California and the United States. With that, I just have a few housekeeping items. Please post your questions in the Q&A section, which should be down on the lower panel. If you have any issues related to Zoom, please post them for the host in the chat section. So don't forget to post those Q&A questions in the Q&A section. With that, I first want to introduce Professor Evelyn Blumenberg, who is a professor of urban planning and director of the Lewis Center for Regional Policy Studies in the Luskin School of Public Affairs at the University of California, Los Angeles. Her research examines transportation and economic outcomes for low-wage workers and the role of planning and policy in addressing transportation disparities. Welcome, Professor Blumenberg.
Thanks very much. Let me get my slides up and running. Okay, so good afternoon, everybody. Thanks for coming to this webinar and for inviting me to talk about what you see on the slide, public transit and its role in meeting the travel needs of low-income workers. It's what I'm going to talk about for 10 minutes. So given the 10-minute time framework, I'm going to just touch on 3 things. So first, I'm going to talk just a little bit about the travel of low-income workers, particularly in the context of this current COVID crisis. I'm going to talk about what I see are some key issues for transit moving forward. And then finally, last slide, I'm going to talk just a little bit about policy, and hopefully that's something that we can come back to in the Q&A. So I'm mostly going to present some text, like you can see here, but also a little bit of data for sort of California. And then again, like I mentioned, hard to talk about this topic without talking about sort of this current pandemic conditions. And so I'm going to do that a little bit as well. So let me start with talking about sort of the travel of low-income workers. And particularly in the context of this COVID crisis, we know that low-income workers are searching and or traveling regularly to work, which is different than the behavior of higher income households. So workers in low-income households have certainly experienced a greater loss of employment income since last March. So what you see on this screen are data, California data from the US Census Bureau's Household Pulse Survey. And you can see among lower income households, And about 61% have experienced some loss of employment income, which means that many in those households are looking for work, trying to enhance their household incomes. So part of the job search. Low-income workers are also less likely to be able to telework than higher income workers. And so I know a lot of researchers are studying this. So you can see among households with incomes less than 50,000, a quarter are able to telework, sort of relative to, the opposite end of the income distribution. More than 3/4 of households with incomes over 200,000. So they are using some form of transportation to get to and from their work. So how do low-income workers commute? Well, they're largely commuting by automobile, but they're more likely than higher income workers to be reliant on public transit. And so again, California data on commute mode share. And so you can see here that low-income commuters largely travel by car. So in this case, we're looking at household incomes under $25,000, which tends to be at or around the bottom income quintile, relative to 85 or 83% among higher income households. Same data, just added the public transit mode share here, again, for California. And you can see that lower income households, commuters, are more likely to be using transit. So here you can see 8% among those in households with household incomes under 25,000. And then, just under 5% among higher income households. Low-income workers are more likely to use the bus rather than rail. And so here I've kind of disaggregated the transit mode share. And so you can see, among commuters and households under $25,000, about 12% are using rail. The rest are reliant on bus for their commutes. And then if you look at the opposite end of the income distribution here on this graph, you can see about half of higher income households are using rail. So consequently, what these numbers translate into is that bus commuters are disproportionately lower income. And you can see that on this slide in the middle are the bus commuters. And then you can see that 70% of rail commuters live in households with incomes above $100,000. Brian Taylor, if you were at Monday's webinar, Brian Taylor presented these data as well. So we know that these trends around the income and the racial composition of transit riders have only grown during this pandemic because of the reasons I suggested before. Higher income workers in higher income households either have a car that they're traveling around in, or they're more likely to be working from home. And so you can see that transit riders are poorer now than they were pre-COVID. There are a lot of challenges. Again, in sort of my 10 minutes, I'm not going to be able to talk about all the challenges, sort of equity challenges that are related to public transit. So I'm mostly going to be sort of talk about this first one, which is the substantial accessibility gap between public transit and travel by automobile. We find that public transit provides less access to jobs than cars within a sort of X minute travel time. So what you see on this graph is the ratio of jobs accessible in 60 minutes by auto relative to public transit in some of the major metropolitan areas in California. So you can see, Riverside, San Bernardino, where cars have a 43-to-1 advantage relative to public transit. Of course, the San Francisco Bay Area is the best case scenario, but still access to employment in this case is 6 times as great by car than public transit within a 60-minute travel time. these trends are sort of growing over time. So there's declining access sort of over time. Part of this has to do with continued suburbanization of jobs and households, despite an increase in some jobs and households in and around central business districts. So while some of that is happening, and I know sort of raises concerns about gentrification, we've also seen at the same time continued suburbanization as well, and reduced sort of proximity to destinations. Certainly, the lack of affordable housing has contributed to this trend. You know, can't find sort of affordable housing in the urban core. Some households are moving outward in search of more reasonable sort of rents, and we've been doing some research on this question as well. And then some interesting work that I'm not a part of, but that is suggestive that the largest percentage of job losses during the pandemic have come in economic centers with large shares of high proximity workers. So these dynamics are playing out in the context of the COVID crisis as well. And that's the graph that you see on the right. I just want to briefly touch on two additional sort of challenges for public transit that I think are important. I'm just going to mention them here. The first one here is public transit in relation to trip chaining. So by trip chaining, it's making multiple sort of stops on a tour. And you can see this is what the sort of the schematic is highlighting, the fact that women tend to do more of that kind of travel, going from home, dropping kids off at childcare or schools, going grocery shopping, going to work, and to home. Certainly an important dynamic for many low-income families as well. So transit it's difficult and very time-consuming to do that kind of trip pattern using public transit. And then the second was a theme that was mentioned again at Monday's webinar. So that bottom image around sexual harassment on public transit. So Anastasia Lukaitis-Sidiris talked about her work in that area. So I think that we can't sort of address some of the equity issues facing public transit without dealing with issues related to safety. So a piece of it is sexual harassment, and certainly sort of racial profiling and the role of the police is important, both related to, you know, sort of transit police and the transit environment, but also getting to transit stops and stations. So that's a piece as well. So what do we do to meet the public transit needs of low-wage workers? And here I'm mostly going to be talking about that first challenge, that access challenge, and just in conclusion, mention three things. The first, I kind of set up the data to talk about this, is that we need to invest in bus transit in particular, working to narrow the access gap in higher density, low income neighborhoods between access by transit and access by automobiles. We certainly need to think outside the box, and I know many transit agencies are doing just that. We have to think about addressing the travel needs of the growing number of lower income and non-white families who live in the suburbs where fixed route transit does not perform well. And then finally, and I know Mike Manville will be talking about this a bit later in this webinar, but we need to better manage driving. I think we put a very heavy burden on public transit agencies to solve all kinds of things, environmental problems. On Monday, at Monday's webinar, we were talking about issues related to homelessness and on. I think that transit agencies have a tall order, and they will not be able to accomplish their mission in terms of that accessibility sort of challenge unless we manage driving. And I'll conclude with that. Thanks, everybody.
Wonderful. Thank you so much, Professor Blumenberg. We will now be moving into our second presentation from Dr. Susie Pike, who is research faculty at the UC Davis Institute of Transportation Studies. Her research covers travel behavior and sustainable transportation with a focus on the use of and planning for public transportation. This includes innovations in public transportation and how transit operators approach the adoption of new technologies, the formation of partnerships, and the implementation of new programs. Her work evaluates the equity impact stemming from innovations, including how digital payment technologies can be accessible to all travelers. Welcome, Dr. Pike.
Thanks so much, Stephen. I'm so happy to be a part of this webinar series. This is exciting, and glad that I can share my work here today. So I've been working on this study for, oops, my slide's not advancing. There we go. For actually going on 3 years now. And I'll talk briefly about some of the early work and then focus on a survey that we actually did this past year in 2020. The study has been focused on trying to evaluate and understand the processes that lead transit agencies to form partnerships with ride-hailing companies. And these primarily entail partnerships that have ride-hailing serving first and last mile travel to access transit. So over the course of the past couple of years, we did a first survey to really look at how transit agencies are getting informed about these partnerships, if they're learning from one another or primarily being guided by the ride-hailing industry. We found that it's a mix. And then we did some follow-up interviews to try to better understand what factors really enable transit agencies to form these partnerships. And then I say enable them, but one of the things that we started to learn from that process is that really it's not that every transit agency has an interest in forming these kinds of partnerships. And so then we started to think more about the conditions that lead up to partnerships, as well as the things that may be barriers, with one of those barriers being, and I'll talk about this more, maybe a lack of interest or just not something that an agency may see as a fit for themselves. So from these early studies, I kind of from the earlier parts of this study, kind of hinted at some of these findings. First, that the partnerships really have to be supported by communication among transit agencies. So through our interviews and through that first survey, we really learned that the transit agencies are talking a lot to each other about their experiences. All of the agencies that we spoke with that had formed a partnership noted that other agencies reached out to them all the time to learn about their experience, what they had done, what worked. And one of the interesting topics that came up was actually about not always about the on the ground details about how the partnership would work, but also a lot about the relationship between the agency and the ride-hailing partner. Sharing contracts came up a lot. And then we also found in these earlier phases that having a champion or someone within the transit agency or very connected to the transit agency who was kind of leading the effort to make the partnership happen was critical. And these are just some of the things that were said in those earlier interviews. Funding, of course, necessary for the partnerships to happen and often comes from within existing budgets. Higher support, and this just means that there's kind of more interest within the agency or the agency board, or even potentially within the public, at least as perceived by the agency, to want to pursue these partnerships. We know that there was one planned partnership in the Santa Monica area that eventually wasn't carried out because they felt like there were negative public sentiments towards the ride-hailing industry enough so that the partnership would not be successful. And then fewer concerns. And so these are all the concerns that we asked about in the earlier phases of the study. And just to note that when agencies had higher numbers of concerns, they were less likely to have pursued the partnership. So these are among the agencies without partnerships, but we compared that to the concerns of the agencies with partnerships, and they tended to have fewer concerns. So all of these things, and then most often the partnerships serve these first last mile connections. So building off of that earlier work, we conducted a third survey this past fall, and we addressed both issues of COVID-19 as well as the partnerships, but we also asked questions in this survey about other kinds of innovations and whether these innovations were being pursued by transit agencies before COVID-19 or during, and how COVID-19 might have impacted their pursuit of these different innovations or their interest in pursuing different innovations. So I know a lot of this material was talked about on Monday, but just from our own survey, we know again that agencies lost revenue and reduced service, and also implemented public health measures. And then in addition to these ones here, a number of our agencies also indicated that they put barriers into the vehicles to protect drivers. And we also know, so I didn't mention this earlier, but I will now, that in our earlier surveys, we found that transit agencies with and without partnerships face the same kinds of challenges. So thinking about the necessary conditions for a partnership to form, it wasn't so much that, oh, this kind of problem, leads to the formation of a partnership. Didn't really look that way. The challenges that agencies have are fairly similar across the board, regardless of whether they form a partnership. And so some agencies form them, some don't. And among all of these challenges, of course, the ones that we see intensified during COVID or noted by more agencies during COVID are things like service costs and ridership, as well as low performing routes. And then of course, cleanliness perception. And I think that is sort of inevitable in this current world that we're living in with COVID. And interestingly, agencies really considered other avenues to maybe to address these challenges or to address other challenges that were coming up associated with COVID. And so these are the different innovations that we were asking about in our survey. So ride-hailing partnerships had a fairly low consideration before COVID, and then that dropped to almost nothing during COVID. Touchless payment, I think, has a little bit more of a hurdle to implement because it involves installing new technology and equipment, whereas things like fare-free transit and mobile ticketing are a little bit easier to implement without major changes, and then without major changes to the vehicles or anything like that. And then on-demand service also not being very interesting to agencies during COVID. And then as before, we still see lots of challenges noted by the agencies with respect specifically to forming these partnerships. So quite similar to what I showed in the results from our first couple of surveys and interviews. So most agencies indicated concerns that relate to drivers, not the drivers themselves always, but in addition, drug and alcohol testing. Drug and alcohol testing came up frequently in our interviews as well as something that there wasn't always clear understanding from the transit agencies of what the current sort of state of the rules were when it comes to drug and alcohol testing for ride-hailing drivers who are participating in these partnerships and receiving the ride-hailing company receiving funding through these transit agencies. So that was one issue where it seemed like a lack of clarity was potentially a barrier. And then, cost effectiveness, data sharing, these are other challenges that were noted by, almost all of or more than half of the agencies that participated in this most recent survey. And then, other factors that I noted earlier were also, again, noted in this most recent survey. This chart shows responses to a question of before COVID-19, what was the level of support within the transit agency? And we looked to see how much support changed before COVID and during COVID for these different kinds of innovations. And we found very little change in the level of support. And so really partnerships, again, have a lower level of interest, a lower level of support than some of these other kinds of innovations or new measures that a transit agency may adopt. So all this to sort of start to try to answer this question about whether these partnerships can really help transit agencies. And what we've been learning really is that they probably can. They do. There are instances where the partnerships seem to be successful. In our earlier surveys, we found that factors considered important in partnership evaluations, such as cost effectiveness and passenger satisfaction, were noted as being achieved. The cost effectiveness especially, as well as accessibility. So the transit agencies that have partnered seem to have the response that it was effective and successful for them. But again, the caveat to me is that it's really only if the transit agency is interested and wants to do these kinds of partnerships. And then just a couple of notes that, as I mentioned, the challenges faced by transit agencies are fairly similar across the board, may or may not lead to a partnership. Partnerships aren't considered as much as other innovations, so they may solve some challenges, but there are other challenges that are potentially more pressing and can be solved with other kinds of changes. And then COVID has certainly prompted agencies to pursue doing some things in different ways, but hasn't really increased interest in the pursuit of partnerships. So again, just that, yes, they probably can help, but only if they want them to. And maybe there's something there to say that we could provide more information or more outreach to transit agencies to consider these kinds of partnerships if we really see that as something that should be introduced more broadly. So thank you very much. And I will turn it back over to Stephen.
I think we've lost Stephen. Oh no, here he is.
You're okay.
So I can't quite read Stephen's lips, but I'm next in the program, so I assume he was introducing my presentation. My name is Juan Matute. I'm the Deputy Director of the UCLA Institute of Transportation Studies, and I have a brief presentation to give on transit employment and race. And so I pulled some data from various data sources to give some insight into transit expenditures in California and positions within transit agencies. So looking at some data provided by the State Controller's Office for 2019 California transit operators expenses by various categories, we see that employee wages and fringe benefits are 45% of total expenditures. And so that is for agencies that are directly operating transit service. Purchase transportation, which includes a lot of what's in this full graph, including salaries, wages, fringe benefits, retirement costs, is another 15%, but that information is not broken down further. And then, so looking at California's transit agencies and who is employed and receiving that 45% of directly operated wages. There are two data sources that include transit financial information. One, which I showed in the preceding slide, is from the State Controller's Office, and that includes all operators that receive some state money and report to the State Controller's Office. And so that's 272 operators representing almost 44,000 employees. The data that I'm going to be showing now is for a subset of those operators, the 39 largest, that represent 35,242 employees. And that's from the Federal Transit Administration's National Transit Database, which just includes additional information that's beyond what's included in the State Controller's Office data set. So looking into those 39 largest transit operators, we see that vehicle operations employees, so vehicle operators, make up just over 60%, or 3 in 5 of transit workers. General administration, just under 11%. And then breaking out the vehicle operations employees, we see that the vast majority of those employees in California are bus operators. There's a fair number of rail operators as well, with the various commuter rail, light rail, heavy rail systems in the state. There is one ferry system, and then some agencies do operate demand response and van pool vehicles with those employees. And so I'll be digging into bus operators in a future slide. But so just as a point of comparison, comparing the transit employment with all employment reported to the, or that shows up in Bureau of Labor Statistics data, 1.68% of government employment in California is with directly operated transit agencies. And that's also 2.4% of all local government employment. And it's 0.25% of all employment in California. So that puts into context the share of jobs that we're talking about when we're thinking about all the transit employees. And the federal transit data allows one to break out average hourly wages. And from this fairly detailed chart, which I'm not expecting everyone to read, the general takeaways are that pay is higher in the Bay Area, and that vehicle operations staff receive the lowest wages, followed by vehicle maintenance and facility maintenance, and general administration positions pay the highest. We also see that rail and ferry positions, so ferry just being in the Bay Area, so also subject to the higher wages in the Bay Area, pay better than bus, which pay better than demand response and van pool. And so the bus positions are not as high as the rail positions, but in a future slide, switching to national data, I'll show how these the racial composition of national bus operators and how the wages compare. And so there is not data available for race and ethnicity of California transit employees. There is data available for 500 race and ethnicity for 563 detailed occupation types from the Bureau of Labor Statistics, Labor Force Statistics in the current population survey. And so in pulling that data for various transportation occupations, and again, this is a national scale, we see that bus drivers, including transit and intercity buses, so this isn't just public transit operators, this includes private companies and public companies that do intercity travel, is about 187,000. And so California, the number was about 10% of that, which holds with our proportion of the national population. And then looking for this various transportation occupations, looking at the percentage of the representation of Black and African Americans in that occupation versus the labor force as a whole. We see that Black and African Americans are 3.06 times more represented in these occupations than the labor force as a whole. And so, and that similar multiple is not present on a national scale for Hispanic workers. We see taxi drivers also have a high representation of Blacks and African Americans, and truck drivers somewhat as well, but not as the same multiple. And so looking at all 563 employment categories that are broken out in this labor force statistics data, and looking at those with the highest representation of Blacks and African Americans versus their participation in the labor force, we see that bus drivers have the fourth highest representation, and are some of the better paying jobs that have a high representation of Blacks and African Americans. Postal service clerks being another position that's predominantly, well, entirely offered by government agencies, that is also a well-paying position. And then filling out these 10, we see several positions, including other correctional officers, other postal service functions that have over 2.5 times as many Blacks and African Americans as their general participation in the labor force. And so, the point here is that changes in funding and changes in service models that affect public transit employment, or at least bus operator employment, will have a disproportionate impact if national trends are similar in California on Black and African American individuals. And connecting this to the rest of the presentations that have been given today, I just wanted to demonstrate from some of the studies that the case studies that Susie Pike was working on, that there are contrasting public employment models for new mobility. And so some models have no effect on public employment. And so Metro Los Angeles, through their Via Rideshare and Metro Micro partnerships, have provided operators whom are Metro employees. Marin Transit has a Connect to Transit that allows people to request paratransit through Uber, and provides subsidized trips on the shared ride Uber to and from major transit stations, but also drives some additional demand to the paratransit provider Vivalon. And then I think Susie mentioned Santa Monica's Big Blue Bus had a Blue at Night service, which subsidized shared Lyft rides to or from the light rail station after 8 p.m. on Fridays. And so from left to right, these different models on the left maybe have a less impact on public employment, and on the right could have a higher impact on public employment, although I haven't studied any of these in particular. The Big Blue Bus also offers subsidized shared Lyft rides for senior and disabled during weekdays. And so my conclusions here are that not all integration of new mobility with public transportations affect public employment or funding levels, but though changes, including changing business models and funding levels that affect employment of transit operators, are likely to have racial equity implications that I think should be considered. And then we do have a knowledge gap with respect to the race and ethnicity for the transit workforce in California in particular. Again, the race and ethnicity data I was using was from a national data set. So that is the conclusion of my presentation, and happy to answer questions in the chat.
Wonderful. Thank you, Juan. I'm going to keep my video off to hopefully stop any technical issues I am having. We will now move on to our final presentation from Professor Michael Manville, who is an associate professor of urban planning at UCLA and a research affiliate with the UCLA Institute of Transportation Studies. Both his research and teaching focus on the relationships between transportation and land use and on local public finance. Much of his research concerns the tendency of local governments to hide the cost of driving in the property market through land use restrictions intended to fight traffic congestion. Welcome, Professor Manville.
Thank you. Let me see if I can start my slideshow here. Maybe having mouse problems. Okay. Thanks so much. And thanks to ITS for hosting us. So what I'm going to talk about in the next 10 minutes is just this question of what the funding of transit might look like going forward. I think that, and one thing I should say, two things I should say right to start are that I'm not going to talk too much about what the immediate implications of the COVID-19 pandemic have been for transit finance. Some of my colleagues at ITS have written some very interesting stuff about that, Martin Wax and Hannah King. But I'm going to look a little bit further into the future and assume that some of our funding mechanisms that that were disrupted by the pandemic, like gasoline sales and sales taxes and so forth, are going to come back in some form. And the second thing I'll say to start is just to acknowledge that transit in California, and especially Southern California, has actually done a pretty good job of funding itself. One of the interesting aspects about public transportation in the US in general, but Los Angeles, where I am in particular, is that it's had a tremendous amount of success raising money, convincing voters to support sales tax increases to finance it and things like that, and much less success sort of getting people to use it. And so if you look over the last 20 years or so in Los Angeles, one of the things we see is multiple ballot measures to finance transit being approved while transit ridership goes backwards. And so this brings me to what I want to talk about today, which is just sort of to have a little bit of a conversation about what that means going forward. And so I think the context here, and this speaks really directly to what Evie was talking about earlier, one of the challenges transit faces is that it's a social service in most of the country, and certainly in Southern California. And so what I show here is data from LA Metro's rider survey and compare it to data from the US Census for LA County. And so what you see here is that compared to the county as a whole, transit riders in Los Angeles are much less likely to be white, much more likely to be living in households with incomes of under $15,000. 44% of LA transit riders meet that definition, much less likely to have a vehicle available and so forth. That basically, the typical transit rider has relatively little money and relatively little political power. And so, as my colleague Brian Taylor has pointed out in a number of good articles, what this means is that if you are a transit operator, you have two different constituencies you have to react to. One is the people who ride, who are your customers, and the other is the people who fund you, which are your voters. And you have to kind of walk a tightrope between them. And that by itself is not that unusual. That describes almost every welfare system, right? If you preside over food stamps or housing vouchers in LA County, you face the same situation where most people don't use your service. The difference with transit is that it's a social service that most of the funders really want to be more than a social service, right? And Evie alluded to this as well, but I think it's a very important point. Most voters who support things like more food stamps or more housing vouchers do not dream of a day when they themselves could be on food stamps or housing vouchers. But if you look at what most people who support more transit financing want, there's at least an implied goal to have a day where everyone is riding transit, right? And so this is from a survey that ITS ran, asking people right after the vote for Measure M, which was a big transit ballot measure in Los Angeles in 2016, asking supporters and opponents and then everyone what they really wanted public transportation to do. And a very small minority of both the supporters and the opponents saw a top priority of public transit as increasing the mobility of low-income people, which is, again, what transit actually does in Southern California. That's who rides it. And instead, what they wanted it to do was reduce congestion or improve the environment and things like that. And so this is a very different understanding of what transit does among people who support it. And people who use it. So, so this creates a real tension in transit finance, right? Which is to say that the appeals that we make to voters and elected officials are very different from what transit currently does. Like we hold out a vision of transit, of a new type of city where people are going to ride transit all over the place. That's very different from what we actually do with transit. So, and you can see evidence of this when you look at different talking points about expanding public transportation, right? So this is a quote from one of the consultants who ran the Measure M campaign in Los Angeles in 2016. That just makes very clear that if you want to build support for transit, the people you want to reach are people who don't ride transit and who have no intention of ever riding transit. Right? So the key audience for us was people who have no intention of ever getting out of their cars. You need to show those voters why the measure matters to them. And the goal is to convince them that this campaign will get others out of their cars and out of their way on the freeway, right? This is the reducing congestion idea. The imperative, therefore, was to reach those who had no experience with transit and no experience of ever riding, right? And so, so this is not a promising way. This is a promising short-term strategy, right? And you can see that in the fact that Measure M1, it is not a very promising long-term strategy. And the two big problems with this are pretty simple to state. One is that it's really, this is going to sound obvious once I say it, it's really much better to aim transit at people who want to use it and not at people who don't want to use it. Right, but the way our political system for finance is set up is that we have to do the opposite, right? Which you saw in that slide, which is that the entire marketing and political apparatus of public transportation is aimed explicitly at people who we don't think want to use it, right? And the way we do that is by telling them that if someone else uses transit, they will have an easier drive. That's a really bizarre way to justify public transportation that we don't think enough about. And one way to think about it is that we never reverse that, right? We never talk about, we never ask people who drive to sort of justify themselves on the grounds that it will make someone else's transit commute better. But we always ask transit to justify itself on grounds that it will make someone's car commute better. And the second problem is that transit can't make someone's car commute better. Right. It's one of the things that everyone in our business knows that is sort of the dirty secret is that transit can't reduce road congestion. And so we should really stop telling people that it can. Transit can help people avoid road congestion. It might make road congestion slightly more efficient by sort of letting us move more people per minute of delay. But if what we mean by reduced road congestion is that someone on a road is going to move faster than they otherwise would, it can't do that. And so the question becomes whether we can sort of thread the needle and simultaneously meet the needs of our social service constituency while nevertheless delivering things to the voters who want reduced congestion and who want a broader, more robust transit system that does more than just be a social service. And if we wanted to thread that needle, we would need a policy that did the following things. One, we would need to largely divorce transit funding from politics, right? So we wouldn't have to go out and appeal to people and say, transit is going to solve these 9 problems for you. And so that would let transit, sort of maintain its comparative advantage, but that would still let non-riders pay, right? Because the base of riders is still too small for us to have them support the system itself. We also need a system that won't bias transit spending away from what transit does really well, which is basically move a lot of people around in a straight line. And then we would want it to also accomplish goals that are important to the non-riders, right? Which is like reducing road congestion and reducing pollution and advancing environmental goals. And as it turns out, there is a policy that does that. We could use congestion pricing on our freeways. Evie mentioned this at the end of her talk, but talking about managing driving. The beauty of congestion pricing from the perspective of someone who's worried about the future of transit, right, is that it raises a lot of money. It's not money that comes from a political process. It's just by charging people an efficient fee for using the road. And you could dedicate some of that revenue to transit agencies, and the agencies could spend it in the way they think is best, largely free of politics. It mechanically reduces congestion and pollution. If you're congestion pricing a road, you get rid of congestion. If you get rid of congestion, you reduce pollution. And it almost inevitably, it's not a statistical certainty that it's going to increase transit ridership, but almost every time we have congestion pricing, we increase transit ridership. And so I think one of the big points here is just that if we really want to help transit, both in terms of financing and its performance, we have to look outside of transit itself and get back to the dominant sort of part of our transportation system, which is driving. And so so it's pricing would simultaneously advance the social service mission of transit and the other missions. So I'll just close with this thought here. If we really wanted to make transit fail going forward, we could do two things. The first one, which we've already done, is we could make driving artificially cheap. And the second one is then we could expect transit to not just compete with artificially cheap driving, but also to solve the problems of artificially cheap driving, which is what we do, right? We want transit to pull people away from cheap driving while at the same time getting rid of the congestion and pollution that come from artificially cheap driving. And so I think it would be much better to remove the subsidies on driving and redirect some of that money to transit than to do what we do now. And with that, I've exceeded my 10 minutes. I apologize for that. I also apologize for my neighbor walking by. But thank you so much. And I will turn it back over to Stephen.
Great. Thank you so much. Really appreciate it. Again, I'm going to keep myself on just sound here. But for all the panelists, if you could turn on your videos if possible, and we'll head into kind of a Q&A section of the presentation. And I think this can be really helpful for us moving forward. It was a lot of great presentations, gave a lot of rounding into what the possible opportunities are that exist in public transit. I want to expand that first further, and then we'll get to some of the Q&A. I do want to ask a question related to what can public transit operators do now? So I guess the question is, based on your research and expertise, what is one key policy or strategy that public transit operators should develop and employ in the very short term? So some of these, there are some strategies that could take longer, but what could be done tomorrow or in the next month? Perhaps we can start with Evelyn, and we'll move along down the line.
Okay, so I was challenged to think about the very short term sort of phrase. So what can they do sort of now? So academics tend to think about these much larger policy responses, or maybe I should speak for myself. I do. Okay, so I think that sort of immediately, I think that transit agencies ought to think specifically about how they're going to use the transit funds that were recently allocated by the federal stimulus. Okay, so that's money that's going to come to transit agencies, and certainly some of them have talked about how they're going to use those funds. Based on the slides that I presented, I clearly think that if we are sort of increasing service, again, short-term increasing service right now, what would be best for low-income communities and households would be to restore and enhance bus service particularly, and I already mentioned, in areas where transit service reasonably connects residents to destinations of interest, so jobs and schools and grocery stores and all of that. And I think maybe, sort of building on some of the things that Susan said, I think that, transit has an image problem at the moment, which is related to sort of safety and COVID. And so I think that sort of actual and perceptions of safety, maybe someone else can speak to exactly what transit agencies ought to be doing. But I think that those are going to also sort of be key in the short term. I'll stop.
Wonderful. Susie?
Yeah, sure. Well, I think when I first think about this question, one of the things that we saw as critical that we learned from our surveys and our interviews is really that transit agencies keep talking to each other. And I think maybe this goes more for the smaller and more rural transit agencies to the extent that they have the capacity to, participate in forums and reach out and speak with some of the larger agencies, or even with some of their, kind of similar sized smaller transit operators, that seems like a real valuable thing to be engaged in. And it's something that did vary among our respondents, and something that seemed critical to just learning about the lay of the land of different policies, as well as, how well different measures are working. So, Evelyn is mentioning, what kinds of measures should be implemented for safety. I think that's a great example of something that transit agencies can really learn from communicating with one another about what's working and what's not working, and then maybe how to pursue, different kinds of measures that they may implement, and what the challenges might be in order to implementing different things, or what resources might be available. Those all seem super helpful to me in that kind of communication happening among transit agencies.
Great. Yeah. So a lot of those technical assistance and knowledge exchange factors there. Juan?
Yeah, I think, more in the immediate term, as counties and regional areas move out of the red tier and the orange tier towards the yellow tier or the orange tier for COVID, it'd be great to see some sort of demand side subsidies program for when it's safe for people to return to transit. So that could include, like, for people who have a smart card, you just get, 10 free rides or something prior to, the end of summer or the end of June, or just to bring people back on to the vehicles, have them reacclimate to use of public transit, because I think the travel behavior that people have exhibited during the pandemic, even for people who have been using transit regularly and then switch to cars or other modes, it will be somewhat difficult, require a change for them to consider use of other modes and get back on transit. So those demand side subsidies could help.
Great. Mike?
Yeah, thank you. I'm not sure what I think transit agencies could do tomorrow beyond some of the good ideas my colleagues have mentioned. I think that transit agencies in general have always been, I guess this requires some cooperation with cities, but they've always been a little slow to take lanes from streets for their buses. Certainly down here, they've been very slow to move toward all-door boarding with their buses. And certainly down here, they've been very slow to really capitalize in different ways on the land they own to get more housing going. And of course, housing takes a while, but they could start tomorrow to get some of it underway. But I think that, and this is sort of pre-COVID stuff, but I think the emphasis that we often have on building out the system has led us to forget that there are a lot of small things that could make transit work a lot better. And I think just, letting people board on all doors, and being more aggressive about having bus only lanes would go a long way toward making transit a lot better.
Great. And so I did see a question pop up that I know Susie just answered, but I do want to kind of bring it back up because I think it affects both Susie and for Mike, and if anyone else wants to jump in. But the person asked, how would ride-hailing partnerships with transit agencies tie into congestion fees and other driving-related policies? So this is kind of hearkening to the congestion pricing? And how do we find the balance between these ride-hailing services and transit as well in terms of environmental impact?
Well, I can start by just reiterating what I noted in my answer, which is really that I think it takes a little bit of both, right? It takes a little bit of making, or a lot of making driving less attractive, as well as some measures to make transit more attractive to more people. And so the ride hailing partnerships really fits in on that side of potentially making transit more attractive and making it more accessible to more people. So it fits that side, but I don't think that can be enough, right? Improvements in transit, as we've heard from others, really can only go so far. We need to also balance that with measures and policies that make driving less attractive, whether it's congestion pricing or something else. And then I think one of the pieces of the relationship between ride hailing and transit that we don't always think about is that even if we don't replace every trip with transit, or even if we make one trip on transit and the return trip on ride hailing, we're still getting a day of travel that maybe doesn't include a privately owned vehicle, and that's a good thing, even if it's a mix of modes.
That's a great point. Mike, do you have any follow-up on that, especially when it comes to congestion pricing and how that might interact with ride hailing?
Yeah, well, I mean, I think one thing that's important to remember is that if you're in a ride hail right now, for oftentimes you're paying a form of congestion charge, right? The way that the algorithm that determines the fee functions is it's a combination of distance and wait time, which means that if you're in congestion, you pay a little bit more. So I think that there's, the purpose here is to get more non-ride hail vehicles, people's personal vehicles, which are the vast majority of vehicles, to be priced more like ride hails. I think it's often fun to sort of hate on the ride hails because they're big companies, and if you're down here, they're from the Bay Area, and no one likes the Bay Area. But really, most of our environmental and congestion problems are just caused by people who walk out to their driveway and get in their Ford or their Toyota, and so we can't. There's limits to our ability to scapegoat this. The enemy here is us, and a universal charge on people who cause congestion, which is the charge on everyone who gets in their car at a time when the road is busy, will fall on ride hails, but it will also fall on everyone else, and some of that money will go to transit. But more importantly, some people will be deterred from charging that money, and they will ride transit, and that will set in motion a virtuous cycle that will be good for transit and for the environment.
Mm-hmm. And following up on that, I just got a question in. I think Evelyn and Juan, you might be able to also jump in on this one. And it's regarding how we can develop equitable congestion pricing for low-income workers and people that have to get to work as expensively and as efficiently as possible. So, for example, workers who just may not be able to change when they are able to get to and from work. And so they can't make that choice in terms of when that congestion occurs. So perhaps Evelyn, you might want to jump in first on this, and then maybe Mike and Juan wants to add, and Susie as well.
So I'm gonna punt here. Mike has done a lot of work on this specific question. So sorry, Mike, to put you on the spot, but you're the best person to answer this question.
Back to you, Mike.
Okay, yeah, no, it's a great question. And I think there's two ways to think about it. One is that the choice of time is not your only choice when you're confronted with a congestion charge, right? So there will be some people who are able to switch to transit, and they will be able to avoid the congestion charge that way. And some people who might be able to change the route they use. And some people might be able to carpool. But if you have two people in your car, suddenly the congestion charge is only half as much. That's not all people, right? I mean, the questioner's point remains valid, which is, what do we do about lower income people who face a potentially high congestion charge? And the nice thing about congestion pricing is that it's a program that comes with a built-in solution to that problem because it raises an incredible amount of money. And so I think the easiest way to deal with that, which we would have to do, is to have some of that toll revenue set aside to subsidize the vehicle travel of lower income people who might be out. Like the point of congestion pricing is not to single out low income people and punish them, right? And so you can, there are different ways, and we're working on different proposals for this at ITS to just identify people who are, under 200% of the federal poverty level or something like that, and make them whole in some way so that they're not unduly burdened. And we do that with other programs as well, water metering, electric metering, and so forth. There's no reason we can't do it with road pricing.
Great, thank you. I know there was a question earlier on, and I'm not sure, it's not showing up in my Q&A box, but I'm still going to go ahead and kind of paraphrase it. But the concern and the question was largely surrounding the mixing of public transit with other types of modes, particularly active modes such as cycling and walking. And I think the question is largely leading to I think, a complete streets concept. And how to actually implement that on an actual scale, and what the planning process looks like. I don't know if anyone has any thoughts on this, but perhaps someone could provide some clarification perhaps on the complete streets concept, and how do we ensure that public transit is not necessarily competing with some of the active modes?
Yeah, I'll say that if you you do have a first best congestion pricing system that is significantly reducing or eliminating the traffic congestion on these arterial streets, one that provides an opportunity to manage the congestion that would happen if general purpose traffic lanes were reduced for provision of a bus lane or bike lane. But then also for routes that maybe have 12 buses an hour, so one every 5 minutes, quite frequent transit service, but there's a fair amount of time in between buses. A congested roadway could provide bus lane-like travel speeds, or a decongested roadway could provide bus lane-like travel speeds, and sort of reduce the need to have a dedicated lane for the bus. And so there are a lot of synergies between congestion pricing and having enough space for transit priority and bicycles.
Yeah, and I think Juan's correct. And the only thing I would add is that there's models of having both a bus lane and a bike lane that minimize these conflicts between those two, largely by just taking space away from the single car travel. And if you look at what London did after it implemented its congestion charge, one of the main reasons they did that is it gave them political cover to just take back a lot of space. You know, one of the problems we have with our very wide arterials is that we have very wide arterials, right? It's not healthy to have 6-lane roads running through the middle of your city that people are supposed to walk and bicycle on, and having a protected bus lane and a protected bike lane, maybe separated by something like bollards or cars or something like that. You know, it comes at the expense of people driving on these arterials in their own cars, but that's probably okay.
Anyone else want to jump in on that? Thank you. No. Great. There is a question, perhaps this can be something that all panelists answer or provide some insights on, is that with COVID and people expanding further out into kind of a mega region aspect, that travel and efficient travel, especially travel to work, is going to be more essential. And we're seeing, of course, still a number of super commuters going to and from their job, especially lower income workers. And so do you have any ideas on how to expand travel throughout California between mega regions, or even within a single region, you know, out to a pretty far area? And the question is it high-speed rail? Is it Amtrak? What does this look like? How does it, I guess, connect with public transit? And I know that's quite a big question, but I think it's also something quite interesting, particularly in the age of COVID.
not gonna answer that, the what to do part. I do want to correct something about low income super commuters. So that is certainly something that we see in the various newspapers. There've been, a number of articles. There was one on the Bay Area that was in the New York Times about, relatively low income super commuters. And we've looked at some of the data. So in general, there is a positive relationship between income and commute distances. So the higher income you have, the longer your travel distance, your commute distance is. Now, while things do looks like, everybody's increasing their commute distance, so that pattern is happening, still that relationship maintains. It's just really hard if you're a low income worker to sustain a super commute. So chances are, if you're changing your residential location, you can't afford housing and you're potentially being, sort of pushed to look further for the sort of urban core for your, for affordable housing. Chances are, if you have a service job, let's say in downtown San Francisco, you're not commuting back into that service job, you're finding it in your new neighborhood. So while you may be living in an area where it's more difficult to get around using sort of public transit or walking and biking, you're probably not likely to be traveling to work, at a, McDonald's. I don't know why I'm picking on McDonald's, but, back in San Francisco, you're doing that in your new neighborhood.
Great, thank you for the clarification. Anyone would like to try to attack this question on travel between mega regions?
I'm not gonna, like Evie, I'm not gonna do a full frontal attack on it. But I think, we do read occasionally about super commutes. There's some person who is on the edge of the Inland Empire and then has to commute into their job as a school teacher in Santa Monica or something like that. And I don't have a transportation solution to that. I do have a different solution to that, which is that Santa Monica could build like an incredible amount more housing. And so could every neighborhood around Santa Monica. And so could basically the entire coast of California. People are super commuting because they can't afford housing. They can't afford housing because every time they go to rent an apartment, there's 20 other people trying to rent it. Like, that's just an inescapable piece of arithmetic that is only solved if we build more housing. And that would let people live closer to where they work and have a smaller carbon footprint and probably a less stressful and more enjoyable life.
So just one more piece to support what Mike just said. I mean, we've been doing some work on this, and in areas where there is more affordable housing relative to jobs, we do find that commute distances are shorter, sort of all else, in our fancy modeling. So I would second sort of Mike's suggestion on the affordable housing side of things, for sure. We're punting. We're working around the transportation question that was asked.
I'm fully in support of that as well. Sometimes the solution isn't a transportation solution to transportation. Sometimes we have to think out of the box, and in this case, it's the affordable, dense housing. Juan, I know you had unmuted at one point. Did you want to add anything?
No, I don't need to add anything.
Okay, great. So we have a question and kind of also a comment related to public trust about public transportation during COVID. So I think there's still a hygiene question on what needs to be done and how, I think to kind of paraphrase the question, how do we build back trust beyond just hygiene, that public transit is safe and is efficient and can get you where you need to go? Would anyone like to be the first one to jump in on this one?
Juan, did you want to go?
Sure. I mean, that sounds like a combination of public health and psychology, or at least perceptions of safety, which is not by any means my area of anywhere near expertise. So I think this will recover as people see more using it. Those who are more skeptical of public transit may be more likely to go on. I think there's been a lot of studies that say that spread on transit vehicles is not necessarily as high as one would have expected at the beginning of the pandemic, but studies have limited influence on individual behaviors.
I'll just add, in a related study that I've been working on, another ride-hailing partnership actually here in the city of Davis to access the Amtrak station for those long distance commuters. I found that, upwards of around 70% of our respondents said that they plan to go back to using whatever mode of transportation they did before the pandemic. And so certainly that's largely driving, but it also included, I think around 20% of people who reported that they would go back to using Amtrak. So it may be that once people feel safe doing things again, they will do them. And one of those things is going to be using transit. I do think the other kind of piece of this question is that, it's not great that everybody wants to go back to driving or everybody plans to go back to doing driving. And so there's this kind of window of opportunity here as people start to do more in-person activities to sort of think about how we can use policies or use programs to maybe steer people away from doing what they might have done before, or to start really, drawing on the habits that people might have formed during COVID to be doing more biking, more walking, and kind of find ways to motivate that to continue.
I think the only thing I'd add is that there's sort of two parts to that question, or at least the way that question was conveyed to us by Stephen. One is, as Juan was saying, this, perception of safety with respect to COVID, and maybe in the United States, what's going to do that more than anything is just as more and more people are vaccinated, right? I mean, people will feel safe as more and more people are vaccinated, and then the environment plays a slightly smaller role in your perceptions of your own safety. And then the other question is, well, controlling for that, how can we get back to a belief that, transit is a good way to move around? And the fact of the matter is, unfortunately, that most people never held that belief before COVID. And they didn't hold that belief before COVID for a good reason, because in the United States, we don't offer good transit service. 2 months into the COVID pandemic in Korea, public transit ridership was back up to 90% of its pre-COVID levels, because in Korea, they run good transit service and they know how to make it safe, and they put a lot of money into it. And so people got on those vehicles. We don't do that. And if we don't do that, then we can't expect anyone to want to be on those vehicles except people who have no other choice. That's just the way it is, right? I mean, if we continue to run bad service, people won't believe it's good, because people can see with their own eyes that it's better for them to be in their cars.
Thank you. And is there anyone else follow up? Anyone else? No. Okay, so I want to ask one kind of final question that will hopefully get everyone on board. And I'm going to tweak a little bit of what I asked earlier. And that's actually, I'm going to do that in 2 ways. So I hope you'll forgive me for this. But the first is, when we think about policies and strategies for public transit, I want to kind of extend into beyond the next couple months and think about long term. And then I also want you to think about what is some policies and strategies in terms of what legislators and policymakers could be thinking about in the long term to make public transit sustainable coming out of COVID-19, sustainable from a financial perspective or environmental, what that looks like, and perhaps just one idea or policy that a legislator or a policymaker at a state agency could really focus in on.
Well, mine will be the same as Mike's, which is congestion pricing for to provide revenues for improving transit service, among other public mobility options. It's easy. It will do the job. It's just politically difficult.
Mm-hmm. And Juan, how do we overcome that political hurdle?
Through limited scope demonstrations that for some areas that want to experiment with congestion pricing, let them do it, pass state legislation that enables them to do it, show that the sky doesn't fall down when it happens, that there's some benefits to it, congestion goes away, alternatives improve, and then it won't be as scary for other places that are considering it in California.
Mm-hmm. Great. Evelyn, I think you were next.
Sorry, I was typing a response to another question while you asked it, but so I hope that my response, that I respond to your question. So I think that, I mean, it sounded like you were focused on transit, and I'm just going to kind of build on what Mike said earlier. I mean, I think that for transit to be effective, I think that our policies need to extend to the relationship between public transit and other forms of transportation. So we just talked about congestion pricing and thinking about automobiles, but I also think that we need to think about sort of other domains. So I agree with the point. I mean, I think that in the short and medium term, I mean, the best thing we could do is think about increasing the number of people who are vaccinated, and transportation can play a role in doing that. And so cities, for example, the city of Los Angeles is contracted with Uber to help provide transportation from South Los Angeles to one of the vaccination sites at the campus, the large campus across the way, USC. So I think transportation can play a role there. And then the other piece of this, I think, has to be on the affordable housing side of things. And so that's not a transit agency, but it's really thinking about kind of the role of sort of affordable housing. And I think that actually would dovetail quite nicely with the managing driving approach as well, providing affordable housing to make transit and walking and biking really reasonable sort of options. So I hope I answered your question.
Yes. No, that was wonderful. And I think also, at least from my work on wildfires and evacuations, that dense affordable housing should also be not in high-risk fire areas as well. We need to be very careful where we start locating some of this dense housing. And then also, Susan Shaheen in part one had mentioned also that Jacksonville Transportation Authority is actually now starting to use public transit vehicles to actually deliver vaccinations to different areas as a mobile vaccination clinic. And I think that dovetails nicely off of what you said, Evelyn, on how to use transportation to vaccinate the population. Susie or Mike? Any long-term ideas for legislators or policymakers?
Susan, did you want to go?
No, I think really I would just, all of the things that are being said, I think are what's important. And it's interesting, I just finished teaching a course on the California Environmental Quality Act. And so that was one of just read lots of papers from students about CEQA streamlining and affordable housing and how, how that's at least one area of legislation to be looking at in California, is sort of how we can get more housing built more quickly and what the role of those kinds of regulations might be in that is something to be examined further, I think. But
Great.
And Juan was correct; he did take mine. But I'll piggyback on what he said. What he was talking about in terms of the politics, which is, I think the way a risk-averse legislator could push congestion pricing, especially in the big coastal areas, is really to have a program that starts it on the freeways with just a couple of lanes, 2 lanes on each freeway, and then in a year or so add a 3rd lane, and a year after that add a 4th lane, and so it's this very long transition period, and during that time there's always a free option, but people can see that it works and so forth. So I think that would be a good way to start to introduce it, and then to just that if we could all just commit to stop saying, right, no one wants to believe that pricing is the way to do it, and so if we could just sort of affirmatively all admit that transit doesn't reduce congestion and transit actually is incredibly important, but it does other things, and let transit do that, then maybe we build a little bit more support for pricing.
Yeah. Fantastic. Well, thank you everyone for all the answers to the questions. Sorry, I had to throw a couple curveballs in there, but I wanted to pick your brain on, and we have such great experts here on the call. So because we are running out of time, we will be just transitioning to just a final last couple announcements. I just want to thank everyone for coming out for this webinar. If you would like to contact the presenters, we recommend that you reach out to them directly. And to stay updated with UCITS webinars and research, you can also subscribe to the UCITS mailing list, in which you can register at www.ucits.org. If you have any questions about the webinar or anything else, you can also reach out to me. My email is stephen.wong@berkeley.edu. With that, have a wonderful day. I see the listserv link has been put into the chat, so make sure you click on that if you're not subscribed to the mailing list. And with that, we hope you stay safe during this time, and thank you so much for attending this webinar. Take care, everyone.